Welcome to CAMC Women and Children's Hospital. Our Pediatric Residency program is a community-based program nestled in the Appalachian Mountains. We are driven to meet the special needs of our population and to teach residents the skills necessary for optimal impact on these patients and families. In addition to the focus on primary care and preparing residents for fellowships, the program emphasizes cultivating interest and providing training in advocacy, clinical research, and quality improvement. Charleston Area Medical Center, our sponsoring institution, is the largest hospital in West Virginia, serving the entire southern area of the state with the following mission statement: striving to provide the best care to every patient, every day. Our pediatric residents train in the only freestanding children's hospital in the state under the supervision of a dedicated group of pediatric subspecialists and generalists who provide continuity of care to this population.
Our program strives to prepare residents for a career in primary care. We promote professional responsibility, skills in advocacy, research, and quality improvement. From the first year of training, our residents are part of the continuity clinic that they inherit and continue to build as they establish their own patient lists. Residents train to provide a healthcare home for their patients starting as early as the first newborn visit and continuing through the years of well-child visits and transitions into adolescent and teen years. Through their own progression from intern year to graduating senior, residents learn to improve their history-taking skills to obtain pertinent information, interpret this information to work through diagnostic skills, and comprehensively tie all this information together to create an appropriate plan of care for the patient. In the clinical setting, residents also learn the skills of detailed and precise charting, billing and coding, and develop leadership skills as they work alongside and mentor their junior residents and rotating medical students respectively. Residents train to provide a healthcare home for their patients starting as early as the first newborn visit and continuing through the years of well-child visits and transitions into adolescent and teen years. In addition to the focus on primary care, the program also prepares residents for subspecialty training through individualized career tracks. Our WVU Pediatric Subspecialty Clinic gives our residents the opportunity to train in pediatric nephrology, cardiology, gastroenterology, pulmonology, hematology and oncology, endocrinology, developmental behavioral pediatrics, rheumatology, a multidisciplinary cystic fibrosis clinic, and child abuse and neglect at our Child Advocacy Center. Residents spend 2 to 4 weeks with the specialist with dedicated time for clinic visits, OR procedures, inpatient consults to obtain a comprehensive management approach within each of the subspecialties.
The emergency room at Women and Children's Hospital provides acute care, monitoring, and observation to neonatal, pediatric, adolescent, adult, and geriatric patients with non-urgent, urgent, and emergent needs. Our experienced staff treats more than 33,000 patients annually.
The Mother-Baby Department provides care to new mothers and their babies and is located on the second floor. A family-centered approach is used to facilitate teaching and learning for parents, siblings, and primary caregivers. Resident learning is focused on identifying normal from pathological in newborn babies, providing appropriate counseling for the new parents, and facilitating the new journey by creating their health home in conjunction with our outpatient clinic.
Our NICU is a Level 3 tertiary care unit providing care to newborns requiring respiratory support, surgery, medical care, and/or close observation. Care is given by an interdisciplinary team, including the availability of a neonatologist 24 hours a day, 7 days a week. Residents spend 4 months of training in critical care with 4 in-house neonatologists managing a varied severity of congenital anomalies, extremely premature babies, learning neonatal resuscitation, getting hands-on clinical experience for placement of intra-arterial and intravenous lines, intubations, and learning to manage enteral and parental nutrition. Our goal is to provide quality care, support the family, and facilitate a smooth transition from hospital to home.
The Pediatric Intensive Transitional Care Unit provides constant intensive transitional care, monitoring, and observation to critically ill children with medical or surgical problems. The PICU consists of 9 private patient rooms and is located on the 4th floor of Women and Children's Hospital. Dedicated pediatric RNs and pediatric intensivists work together with multiple disciplines such as residents, respiratory, pharmacy, nutritional services, physical therapy, and child life to provide patient and family-centered care. Residents spend 2.5 months in the PICU, training as critical care physicians, with the opportunity of co-managing the PICU during nights and weekends, with support from off-site attendings. Residents in our program have the first opportunity for hands-on clinical skills and procedures as there are no fellows to compete with, creating medically sound and independent physicians who are well prepared for fellowship.
The 5th floor is home to our Pediatrics inpatient service team. The Pediatrics floor has a 30-bed capacity with 4 private rooms. Residents spend a total of 9 months on inpatient service with a focus on diagnosing and managing a variety of pediatric pathologies. During this rotation, residents gain a comprehensive experience through day, night, and weekend calls while learning to work effectively as part of an interprofessional team, with interactions with colleagues, learners, and our in-house specialists. Family-centered rounds allow for a multidisciplinary approach with nursing, pharmacy, and a child life specialist, along with promoting effective communication with the patients and families. The Resident Corner is a dedicated space for the pediatric residents on service to facilitate daily discussion regarding patient care approach, pediatric review articles, and didactics covering boards, prep, and content specs.